spirit to nourish the moral will of the American people. I believe it will loosen the loathsome manacles of American health finance, an exploitative institution that profits by plundering from us our own bodily autonomy, and that anchors a larger exploitation that holds those whom we love as captive leverage to guarantee our servitude to abusive employers or domestic partners, to those who seek to dominate us both in the office and in the hospital. I believe this nation owes its people, whose labor has created its rich banquet, the safety and agency of healthcare. I believe this healthcare is greater in scope than that which happens upon an operating table. I believe that housing, food, income, and more, the components of basic human dignity, are healthcare. And I believe our work is that of striving toward justice for all people. And I therefore believe, I have to believe, that single-payer healthcare is our moral imperative. Single-payer is our tool. Single-payer is our weapon. Single-payer is our first step. But single-payer on its own is not the goal. This is a book about health justice. Healthcare is personal. So I want to start this book personally by introducing two friends of mine, Steve Way and Kyle Kolick. They're two guys about my age, I'm 30, who live in North New Jersey. They're sweet, gentle people and probably the most charismatic pair of friends I've ever met in my entire life. They make me laugh until my face hurts, and we like watching pro wrestling together. They're also being utterly broken by our American health system, and it's keeping them from living their lives. Steve has muscular dystrophy. The muscles and tissues that hold his body together are eating themselves. He's doing pretty good, all things considered. He beat his original life expectancy of 18 and now probably has a long life ahead of him. Steve needs a wheelchair to move and a ventilator to help him breathe. He also needs help getting dressed, going to the bathroom, eating, and other everyday functions. His family takes care of him, but Steve doesn't want to be dependent on his parents for his whole life. He wants to move in with his girlfriend. But Steve can't afford to hire a private personal medical assistant 24/7. I mean, who could? In many parts of the United States, if you can't receive care at home, you have to live in a nursing home, or an SNF, a skilled nursing facility. Nursing homes are private institutions for people who can't live on their own, like people with disabilities and senior citizens with advanced medical needs. But many people do not want to live in a nursing home. Caregivers are massively overworked and deeply underpaid, and the result is often shallow, loveless care with high rates of medical negligence. Nursing homes have been caught bribing judges to reduce their medical malpractice lawsuit damages, sending their own corporate officials to run for office, who then make it harder to file a malpractice case, or hiring their own lawmakers directly as employees. These are not good prospects for someone who needs medical care, nor for someone who wants to be permitted to live freely instead of being imprisoned in a warehouse. Nursing homes are where people like me go to die, Steve says. Because Steve wants to avoid all of this, he needs Medicaid. Medicaid is an insurance program funded jointly by federal and state governments for people who don't make much money and people with disabilities. Medicaid pays for much of Steve's health care and also a home health budget, which he can use to pay home health aides to come over a set number of hours a week and assist him around the house. Home health aides help Steve move, cook, clean, refresh his meds, and stay healthy. They mean he can lead the life he wants to, like all of us do. But not all state Medicaid programs pay for home health, and few of them pay for it in the same way. Paid or not, the work must be done. For most of his life, Steve's family, especially his mother, has pitched in to take care of his health needs. Being able to receive care at home makes Steve incredibly lucky. Getting Medicaid to pitch in took a long time. A few years ago, after a lot of phone calls, paperwork, appointments, and waiting, New Jersey Medicaid approved Steve's request for home health funding. Some people hire external home health aides using Medicaid, but Steve was able to use this money to hire his mother so she could be compensated for some of her help. This took some of the sting out of her not being able to work as many hours as she might otherwise like to outside the house. Then came Kyle. Kyle and Steve's friendship started before they were born. Kyle's mom and Steve's dad have been friends since middle school. Kyle and Steve started hanging out and writing sketch comedy together sometime between high school and college. Kyle decided to go to acting school in New York, then met his wife and settled in Astoria, Queens. A year later, his back...